Thank you, Madam Chairman. It is indeed a pleasure to serve under your chairmanship, and I must begin by congratulating the Honourable Member for Worsley and Eccles South for securing this important debate. Now, Madam Chairman, Winterbourne View Hospital was in my constituency. The horrifying evidence of the systematic abuse of some of the most vulnerable people in our society, which happened in a place where they were meant to be safe and looked after, came to light just a year after I was first elected to serve as the Member of Parliament for Filton, Bradley, Stoke. Immediately after the Panorama documentary was broadcast, I summoned the Chief Executive of Castlebeck, who ran the hospital, to Parliament, to Westminster, and told him that the hospital had to close and that patients properly looked after in a sympathetic and caring manner. Now, nobody who watched the documentary could be anything other than horrified by what they saw, a total and complete failure of humanity, empathy, and any sort of care on the part of the staff responsible for these vulnerable adults, and a catastrophic failure of agencies and organisations to act sooner, which could have stopped this abuse before so many people fell victim to it. In 2010, Terry Bryan, a former senior nurse at the hospital, brought forward concerns about Winterbourne View. As the council states in their report into the hospital, his concerns made no difference to an unnoticing environment. The Care Quality Commission also acknowledged that they didn't respond to Mr. Bryan's concerns. According to the report, they didn't follow up because they thought Castlebeck and the council were doing so. Now, as I said in the House in September 2012, 40 safeguarding alerts were sent to the council, but not acted upon. Correct, 40, because the council assumed the hospital was being honest. Many of these terrible incidents could have been avoided had these alerts been dealt with. 29 contacts between the hospital and Avon and Somerset Police were reported between January 2008 and May 2011. The police acknowledged that in those which involved staff on patient incidents, they relied far too heavily on the hospital's information instead of listening to what patients were telling them or properly investigating concerns. Now, only one member of staff was ever prosecuted before the documentary was aired. Winterbourne View was a catastrophic failure of corporate responsibility and care for the most vulnerable. In October 2012, I asked the Prime Minister at PMQs if care providers should be prosecuted for willful corporate negligence if patients in their care had been abused. And in 2013, I co-signed with other colleagues a private member's bill to hold corporations criminally accountable for abuse and neglect in care settings. Now, I'm glad to see that since this dreadful incident, the government has put in place some measures to improve the care of residents, and I welcome the steps that the government has taken through national agencies such as the NHS and local authorities to ensure that care providers and givers are adequately resourced and that patients are adequately protected and that their families can have confidence in the care system. In December 2012, the government published the Transforming Care report. It was, of course, vitally important to look at what lessons had to be learned and what actions the government must take to stop this abuse ever happening again. And there were some changes made. The government had introduced a more rigorous registration, assessment and inspection process for learning disability services. And the Care Act in 2014 set out a new basis for adult social care, which included the concept of well-being for individuals, which includes people being in control of their day-to-day lives, residents having suitable accommodation and being able to contribute to society. And the Act also reiterated the importance of good quality, independent advocacy and supports people, their families and carers to help them raise concerns. And it also requires local authorities to consider people's views, wishes and beliefs and focuses on the end results that people themselves want to achieve. Now, in January this year, the government closed the consultation on reforming the Mental Health Act, and the changes that the government is proposing or are proposing are based on 4 principles which are patient-centred. These principles are choice and autonomy, using the Act's powers in the least restrictive way, ensuring patients are supported to get better, and ensuring patients are viewed and treated crucially as individuals. And the changes will allow people to make choices about their own care when they are well and choose who might represent them should they become unwell. Now, the government has focused, as has been said earlier in this debate, on reducing levels of inpatient care for people with a learning disability and or autism. Hospitals are not where people should live, and the government is committed to move more people into community-based support. And however, as we all know, ambitions for this have been postponed, with the most recent targets for a reduction in inpatient provision of 50% compared to 2015 levels for 23-24, as set out in the NHS long-term plan. Now, as the Commission recommended, the priority for government now must be to improve access to community-based mental health support, including crisis care, to prevent avoidable detentions under the Mental Health Act. I'm pleased that this is already underway, backed by a ring-fenced fund of 2.3 billion a year as part of the NHS long-term plan. But Madam Chairman, we must continue to learn the lessons from the terrible events at Winterbourne View. Those who are entrusted to the care system and their families must be confident that their well-being is the highest priority to those responsible for their care. And of course, we must all continue to ensure this horrific abuse can never be repeated. But I'd also like to say that it cannot be in any way justifiable or a way that it can be just explained away, that alerts are ignored by local authorities and police as they were with this terrible incident. This could have been prevented and should never have happened.